to reinforce the importance of having advance directives. Dr. Patricia Bamba and David Rhodes is here filming today. This video will be actually used to help educate members of our community. And it's quite an honor to have you in the video because your faces are very well known throughout the community, and it adds credibility to the belief that advanced planning is very important, especially for African Americans, because it's something that we don't do. You know, we tend to wait until a crisis to talk about, do we put mom or dad on life support?
You're trying to help them understand that, look, it's not about what you want, it really is about what that person that's no longer with us wants. So you can't wait until the last minute to plan the end of your life. You don't know, it might happen today. You might leave here, God forbid, and something happens and you will not be able to make a decision for yourself. I get sick and tired, I don't know about you, I'm almost sure every minister around this table also gets sick and tired of always being in the middle of a family conflict when someone, God forbid, loses their life. No one knows but that individual what they want and what they do not want. And the only person that's going to be able to do that for that individual is somebody that you trust to honor your wishes when you're not here. And I'm just tired. Medical orders for life-sustaining treatment, how do you know what you want medical providers to do? You might know, but if you don't share it with somebody, it's not likely to happen.
We ourselves should make plans also.
Oh, absolutely.
And that's the sad part about it. We haven't made any plans. We're in situations now where I should say, I get to the point where I see we got to beg people because of the inheritance. You got to beg people to bury the parent because the money was left to one and that one didn't care. But we should be making, I think it should be stated that we should be making provision now. I see people lose homes, lose land to the government because they're arguing about what mom and daddy said, and mom and daddy gone.
Exactly.
In the ground.
Exactly.
So basically what you're saying is that though we have a health issue and it is separate and distinct, there are the financial side which don't reinvent the wheel. You need to pull all of that together.
Yes, you do.
To deal with the dynamics of it.
It's up to us to help educate our communities to get those things completed. You know, an advance directive that's not complete is no good to us. You want to choose someone who is going to fulfill what your wishes are. My husband had a mother who was 94 years old, and she had a living will like 50 years ago, before you even really talked about living wills and choices. And she knew that if she was able, at some point in her life, not able to eat, she did not want a feeding tube. My husband struggled with that. He really felt when she stopped eating, we have to do something. We have to get mom a feeding tube. And I reverted back to what was your mother's choices. It's about what she wanted. It's not about what's going to make you feel good.
The average person wants a family member to decide, and they can't decide for themselves. But the perfect person is the person that's going to honor your wishes. I don't know what my dad wanted. I didn't push him to give a proxy, to write a proxy. However, everybody was expert on what he wanted. He was the only one that knew what he wanted. So you have to write it down. And once you write it down, tell somebody, you aren't my proxy. I would never want my daughter to be my proxy. You know why? She'll do just what I did with my dad. She would say, I know, Ma, you said that this is not what you wanted, but I am not letting go. So, you know, you want to really carefully consider all of those things. Living wills, proxies.
Okay,
What do you want to do?